After the fright he has had, Ramon has realized that he needs to make some changes to his lifestyle. 2 months ago, he decided to stop smoking. The nurse at his primary care center helps him in this process, and so far, he hasn't smoked a single cigarette since then. He also eats more healthily. He misses the fast food and the pastries, but he tries to replace saturated fats with fruit and vegetables. Every evening, he goes out and walks for 30 minutes before dinner, following a number of health-promoting routes available in his town. He has made many new friends, and he has met Marta, who developed a chronic heart failure some years ago. Marta knows a lot about her disease, and Ramon asks her about the things that worry him. He thinks that learning from his experience and following a healthy lifestyle will protect him in the future. He has no wish to have another heart attack or develop a complex chronic disease. He's made up his mind. He needs to make a change in his life. It's not long before Ramon feels much better even than before the heart attack. He looks after himself and is more aware of what is entailed in living life with better quality. The health plan seeks to reduce the population's risk factors, which is why it is promoting the Interministerial Public Health Plan, PINSAP. The PINSAP promotes health in all policies beyond the natural limits of the health system. Smoking is the primary cause of loss of health and one of the main risk factors in chronic cardiovascular diseases. Ramon can now benefit from the health of primary care professionals who offer advice and counseling to help him give up smoking. At the same time, 061 Cat Salut's Response Health Program has drawn up a personalized plan for him to stop smoking, and a nurse provides additional follow-up by telephone. Ramon also knows that it is important to follow a healthy diet. Apart from eating lots of fruit and vegetables, he usually eats in restaurants with the AMED certification, which is a pioneering initiative aimed at promoting the Mediterranean diet in restaurants. Ramon has stopped smoking, eats healthily, and uses the healthy walking routes available throughout Catalonia and designed by the Physical Activity, Sport and Health Plan, PAFIS. In his area, he has several routes to choose from where he's sure to get exercise. Marta is extremely consistent. Since her doctor diagnosed her with chronic heart failure, she has learned the importance of living more healthily. She also controls the risk factors associated with her disease, such as high blood pressure. She also takes the prescribed medication to control the heart failure and maintain a good quality of life. All of this helps her feel a lot better, but what has contributed most to her positive outlook are the people she has met through the Patient Expert Catalonia program. Although Marta is in a situation where things can easily go wrong, she's managed to maintain her ability to look after herself. This means that she needs hospitalizing less often and doesn't have to go so much to the emergency department. All the merit for Marta's success in managing her disease is hers because she looks after herself. But the tools she has to do this have been provided by the system, which consistently works to improve the quality, accessibility, and safety of care for chronically ill patients. The health plan has addressed the structural challenge posed by chronic diseases by radically changing the care model to refocus the system on chronically ill patients, such as Marta. The care pathways allow professionals on different care levels to coordinate with each other and work together under the same medical criteria. The medication guidelines have been harmonized to incorporate new developments originating from scientific evidence and cost-effectiveness criteria. Apart from taking the medication, Marta knows that she can avoid and control risk factors by acting on the health determinants, particularly with health promotion and preventing activities. That's why she walks every day, follows a healthy diet, and measures her blood pressure at the local pharmacy to make sure it isn't too high. She has learned all these self-care actions at the Patient Expert Catalonia program at her primary care center, where she meets each week with a group of people with chronic heart failure. Marta knows more about her disease. Whenever her condition becomes unbalanced, she knows she has care alternatives apart from the emergency department. Now, she is admitted directly to the subacute care unit through primary care. This care circuit is key for the system's speed of response and early assessment by the health professionals who have a care alternative for people with chronic diseases like Marta. Thanks to the health plan, chronically ill patients are better cared for because health professionals are not focused on the disease, but on the person.